Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. Phenomenal questions. I can hardly wait to get to them. First question was, my question, how does someone completely take care of Morgellons disease or skin problems, or they call them skin parasites? I have studied this a little bit and I've seen videos on the internet with particles actually leaving a person's body. You know, we really just focus on cleaning the system up. We use a product that's a citric seed extract. We use oregano that's been emulsified. I would really need to look at your numbers. I know the liver is really important because it gets rid of unwanted, unnecessary organisms in the body. I'd have to literally see how your thyroid is doing, your white blood count, the different areas, and we'd need to address that. But we do treat a variety of conditions where blood cells have been altered. That would be the immune fighting cells. Good question. I wish I could have answered a little bit better, but we just have to follow the numbers. With Hashimoto's thyroiditis, which is usually low thyroid, is it okay to take iodine? And you mentioned extra iodine. I follow the numbers, TSH, T3, and T4. There's differences of opinion on Hashimoto. Some say to use iodine, others say not to. I want you to know something that we just started doing in the practice. So we started having our female patients apply a drop of iodine, liquid iodine, to their breast. And we're starting to see some thyroid problems that were not responding before responding to this. We're seeing more and more ladies with PCOS and other issues, which is lack of iodine. So all of you out there right now, you could try some liquid iodine on your breast. You can contact our office for the website. At our website to get the best iodine for your health and your body. Someone had a question about lupus. I had a 15-year-old friend diagnosed with lupus. Lupus usually tells me adrenal fatigue, sugar. It's sugar, and it's a hormonal issue because a 15-year-old usually has a liver that's being compromised. This person had a triple heart bypass and wanted to know about salt because they've been on a no-salt diet, which I don't agree with. We use Celtic sea salt and unrefined salt. You know, I'm beginning to see lack of good minerals in the body can cause heart problems. We have a tool in our office called an acoustic cardiogram that we can assess, function, the nutritional snapshot of the heart. I'm not telling you to go to a franchise restaurant because I avoid those. Those put a lot of sodium in your body. I eat a very pure diet, but I use a lot of Celtic sea salt. Someone said they see a lot of my articles on hypothyroidism and their medical doctor wants them to go on Synthroid. First, I don't have a license to tell people to go on or off any kind of medication. But we follow the numbers and we have a plan. We look at the numbers. You could go to Dr. Bob's Drugless Guide to Balancing Female Hormones, see my observation on that. We help a lot of people in conjunction with their healthcare provider to go drug-free when it comes to the thyroid gland. Someone wanted to know about the ABCs and should they juice it every day. I don't promote juicing every day. I'd rather have you eat the food every day. Beets and carrots and apples, yes, they might be a little bit higher in the glycemic range, but you don't want to juice. Probably the best way to lower the A1C is to exercise and focus on green vegetables and protein. What about the natural treatments for a pituitary adenoma? First time I ever had that question. B6. I know the pituitary gland needs B6, and some time ago I read a very interesting article about vitamin E and manganese and selenium, especially for the pituitary gland. Selenium would be a product of choice along with the vitamin E. I also would look for parasites because they like to hang out in different parts of the body. Are there special health concerns for someone that's 55 and they need to lose 77 pounds? Green vegetables and protein. You can lose 3 pounds a week on green vegetables and protein if you exercise, a half hour every day. Someone had stiff joints. What we're seeing with stiff joints is get the little tool called an oximeter. I've done a program on that in the past. Your oximeter, which is a measure of saturated oxygen, should be 95 or greater. We've had great success using phosphorus capsules and or tablets with chronic body stiffness. No sugar, no dairy. Tremendous questions. I'm Dr. Bob DeMaria.